I think you should speak up for yourself. And I think sometimes when you speak up for yourself, you end up inadvertently speaking up for other people too that had the same thought that maybe just didn't say it. And I think that, over the course of the years, me saying, hey, I don't agree with this. I really think we should talk about it. I think we should change it. I think sometimes too, people aren't aware that things aren't great. Like, for women, for Black and brown people, for trainees, whatever. And they're just like, oh, I just didn't know that was something that's important to you guys. And so having me be able to be like, yeah, this is an important thing that we need to pay attention to, I think has made differences.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel.
Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Pamela Mehta, and today I am joined by Dr. Iman Boston. Today, we are going to talk about imposter syndrome, navigating self-doubt in your career. Dr. Boston joins us today. She's a distinguished physician specializing in advanced endoscopy. She heads the third space and advanced resection program at Beth Israel Deaconess Medical Center in Boston, Massachusetts. She's also the associate program director for the Advanced Endoscopy Fellowship Program at BIDMC. And she is passionate about increasing the representation of women and Black and brown physicians in gastroenterology and advanced endoscopy. Thank you so much for being here, Dr. Boston, today.
Of course. Thank you for having me.
Of course. Okay, so why don't you start by telling us a little bit about yourself? We have so much to get into, but I would love to hear about sort of your road to academics.
Yeah, sure. So, actually it's funny because there was a time when I actually thought I was going to go into private practice or into community-based practice, but I've really had sort of I'm going to say a coming to Jesus moment. So, as I was going through my training, initially I thought I was going to do, I really didn't like internal medicine, thought I was going to do anesthesia, but then I was like, I don't know if I'm going to like this either. And like some other people ended up switching over to internal medicine so that I could do GI. And what I realized as I went through is that like all of my mentors were men and men that didn't look like me at all, which is fine. Don't get me wrong. But I noticed that there was really a paucity of women. There was a paucity of Black and brown people or people that I could otherwise relate to just sort of on like a, on another level, let's put it that way. And so what I recognized too is that same thing was sort of happening with trainees, right? So trainees eventually become these attendings. And so I was like, how can I change this or how can this be changed? And it's really by having, to me anyway, by having mentors that sort of tell you, hey, you can do this or you should do this. And even though I chose this path without having people that look like me, I think it's important. I think a lot of people are searching for somebody that they can relate to and they sort of are like, this person is doing that and they're just like me. I can do that too. And I felt like I would be better equipped and better prepared to be able to do that, to kind of bring more women, more Black and brown people into the field if I was in academics.
Absolutely love that because as an orthopedic surgeon, I had not one female attending. It wasn't even that I didn't have a female attending mentor. There was not a female attending in orthopedics at all of the Columbia hospitals, not even one. So
crazy.
I was a little bit more selfish than you, wanted to get the heck back to California and I took an employed position, but I find that so great that you had that perspective that if I disappear into private practice, then this is going to continue this. And you really found that to be important. Okay, so from branching off from there, what do you feel has been the most important part of your role in academics and how do you try and mentor Black and brown physicians or just young physicians in general?
Yeah, I'm loud.
We are too at Pinnacle.
Like, listen, if I don't like something, and even like as a trainee, I was the same way. I was like, this sucks. Like, this needs to be changed. It's horrible. Like, whatever. And I didn't feel, and it got more, my voice got louder and louder as I went through because I was like, one, I don't need this. Like we're good. Like, it's kind of like, look, I want to do this, but at the end of the day, it has to make sense. And these things are not working. And so I was always very loud about those things. And I think honestly that's been helpful. I've even had some trainees now that are like, you just impressed me by the fact that you just tell people like, this is horrible, we should change it. But I think that's important. I think you should speak up for yourself. And I think sometimes when you speak up for yourself, you end up inadvertently speaking up for other people too that had the same thought that maybe just didn't say it. And I think that over the course of the years, me saying, hey, I don't agree with this. I really think we should talk about it. I think we should change it. I think sometimes too, people aren't aware that things aren't great. Like, for women, for Black and brown people, for trainees, whatever. And they're just like, oh, I just didn't know that was something that's important to you guys. And so having me be able to be like, yeah, this is an important thing that we need to pay attention to, I think has made differences. And even like as a fellow, I remember I always was like, able to, I think because I was loud, able to sit in on some of these meetings that I really, maybe wouldn't have otherwise been invited to, particularly for recruitment. And some of that was like, hey, we need more people like this, right? We need more people that are people that look like our patients, that really represent our population. Because, and even like all the time I had someone yesterday, actually today, that was like, you're the first Black doctor I've ever had. Ever. And this man is like 75. So that's ridiculous.
Isn't that crazy? Yeah, that's crazy.
So I think it's super important that we sort of increase the field with people that really represent the patient population. And I think it won't happen unless people are very intentional about it. And so I think that me being like, listen, this is important to me. I don't care who it offends. I don't care how you feel about it. This is what we need to do. I think that's been really helpful. And I think the other thing is I've taken on some mentees elsewhere, not even within my institution, but also just people I run into like at conferences or like, hey, I have a friend who has a daughter who is in med school or whatever, and just kind of taking on these different people that are like, hey, you could do this. This is great. And even if they don't choose to go into GI, I'm fine with that too.
I absolutely love that. We need more people like you. Absolutely. And what I would say also is that to your point about sometimes people don't even know what it is they need and should be fighting for. And it's often good to have a loud voice out there. We need more women with loud voices because God knows how many men have loud voices and get heard every single day. So we do need more of that. And I think it's very scary for the younger generation when you're in training, when you're a medical student to have a loud voice because you feel like there's going to be some sort of repercussion against you. And so I think we have to take that torch and lead the way and use our voice. And sometimes it's really hard because I do the same, and I often feel like I'm the thorn in people's side because I won't let something go, and I could just, keep it moving because I've already made it in my career. I'm already there, so I don't need to say anything, but I recognize those things too. Can you tell me a little bit about Third Space?
Yeah, so it's a relatively sort of newer part of advanced endoscopy. It's funny because I always struggle, like when people ask what I do that's different from general GI, I always struggle a little bit because I'm like, well, there's just so many different techniques and procedures that have come about. But Third Space specifically is sort of mainly consists of, I shouldn't say mainly, but honestly, I'd say mainly, consists of like poem procedures where basically people that have achalasia or, EGJ outflow obstruction or gastroparesis, for example, they need like the muscle of their pylorus cut or they need their lower esophageal sphincter cut, but they don't want a big surgical procedure that, has a longer recovery time. You can actually do that endoscopically by creating a tunnel basically either in the stomach or in the esophagus and actually cutting that muscle. And then sort of the other thing that I think I do mostly is something called ESD or endoscopic submucosal dissection, which is great because it saves people with these huge flat polyps or what have you, otherwise can't be removed except surgically. Now they have an option to actually have those removed endoscopically as well. I think that's probably another reason I went into academics too, maybe on the more selfish side of things is, those procedures take quite a long time. Like I did one yesterday, it was 4 hours long. And
wow.
The reimbursement for that is still not quite where it needs to be. I think we're still fighting for adequate reimbursement for it, trying to get the surgical RVUs and all that kind of stuff and surgical reimbursement for these things, right?
Yeah, don't get me started.
Yeah.
That's a whole other topic for another podcast.
So, in private practice, you can't possibly spend the time to do that. So academics kind of gives you a little bit more cushion to be able to kind of do some of those like things that you like to do that maybe won't make you as much money as they will hopefully in the future.
Great. Actually, since we've touched on this, why don't, for a lot of our listeners who are maybe younger and haven't decided upon what kind of practice model that they're going to approach or join. Maybe you can touch on that a little bit more, because you brought up a great point about reimbursement and being in private practice versus academics. For our viewers or listeners out there that may not understand those nuances, maybe you can explain that a little bit better of what it means to get reimbursement as a private practice doctor versus in academics, and why some of these procedures are better done on the physician side at an academic center.
Yeah, so what happens in private practice, I think a lot, it's harder to argue. I'll put it this way. So basically, physicians get paid based on RVUs, right? And so the private practice model is very much driven by how much money are you bringing in. So not necessarily what service offerings per se they want to do. So with private practice, a lot of times you're paid exactly by the RVUs that you make, and that's it. That's the end of it. And so what happens is if you're doing a 4-hour procedure, let's say, and it's this ESD, for example, so you essentially end up more or less getting paid by the insurance companies, for a colonoscopy, which is not going to be reimbursed, over 4 hours if you're doing one colonoscopy because it took you that long to get that polyp out, versus, on a normal day, if you're just doing colonoscopies for screening or whatever, maybe taking a couple smaller polyps, you could do, 10, 20 of those in that same time frame, right? So you're going to get a lot more RVUs, a lot more dollars back from the insurance companies. That's what private practice really cares about, is how much money are you bringing in? And you basically get paid to reflect exactly that, right? In academics, it's a little bit different because you oftentimes, on the physician reimbursement side, can actually argue with the hospital or negotiate, I should say, with the hospital for higher RVUs. So maybe the insurance is not paying the hospital what they deserve for the time that you spent doing that procedure, but the hospital pays you, the academic center typically will pay you for whatever RVUs you're able to agree on for that procedure, because that's something that they want to be able to brag and say, yeah, we offer this exciting thing, whatever it is. So that's kind of how it works a little bit differently in academics versus private practice. They're just not quite as driven by dollar for dollar amount.
Thank you for that little pearl, because a lot of what we do not do well is teaching medical students, but whether male or female, how this all works in the real world. And so I think that's a big problem for when we're making our decisions of how we want our career and life to look, is we don't actually understand a lot of this. And unfortunately, there's a lot of physicians that don't even understand it once they're in it. They don't know what kind of positives you can get out of being in academics that are monetary in this way that you're talking about versus private practice. So thank you for that. I want to now touch on imposter syndrome. Tell me how you've navigated this in your career.
Yeah, I'll tell you two things about that specifically. I don't know. It's funny because sometimes I think, do men have this as much as women? I don't know the answer to that, truthfully, but at various points I've gotten to a place where I'm like, man, do I really deserve this? Like, what about me makes me feel like I should be here, or what about me makes other people feel like I should be here? Like, no matter what it is, honestly, at every stage I've been sort of like, man, it's just crazy. Like, I can't believe I'm here, right? And not so much of, I deserve this because I worked hard for it, which is what the default should be, because I did. But there's just times where you question yourself and you're just like, I don't know if this is really something I worked hard enough for, or something I deserve. There's maybe somebody better suited for it. And I remember a time specifically when someone asked me, and it was a simple thing, right? Somebody asked me to speak on a panel. And it was a panel for ASGEs, like one of their lead and gold programs, which is like these really prestigious leadership groups within the ASGE, which is one of our national organizations. And I remember, like, after I realized what the panel was about and who else was on the panel, I sent them an email and I was like, I can't contribute anything to this conversation. Like, why did you ask me to join this panel? And they were like, because we think that you can contribute something to this conversation. We specifically asked you to join. We didn't just, pick a name out of a hat. Like, we asked you to be here, right? And so I remember I did the panel and I was really happy that I did, but that was just like a small thing where imposter syndrome came in, because I'm like looking at all these people with all their credentials and I'm just like, no way, I don't match up, right? But I think what happens when you do that is you count yourself out before you're really even in the game, right? If someone gives you an opportunity for something, and even if they don't, you deserve it. And honestly, worst case scenario, somebody says, no, you're not ready for it. And that's okay too. But I think the thing that has really helped me over the years, honestly, are the people that are around me. So some of my mentors, in fact, one of my best mentors actually is somebody that is a white man who, on the outside, we don't have anything in common at all. But he's been just like a huge, huge, huge advocate for me. Even now, like, part of the reason I'm the associate program director is because he was like, I think you'd be great for this. Like, this is what we should do. But it wasn't something that I would have necessarily thought of if he hadn't suggested that. So sometimes people can sort of take you out of that and say, no, stop, you deserve this. Stop thinking like that. And until you get that, to that place yourself, I think that having the people around you that are like, no, I recognize this value in you and you should too. So I think that's super important.
Well, I think, having people around you to help you with that is so important. It's part of what Pinnacle is based on, to be honest, is just to be in a room full of women, whether live at our conference or virtually, to have those people say, hey, you can do this, or I'm doing it this way, so can you.
Right.
And I think an answer to your question is no, they don't have this, the men. It's not part of their DNA, and they don't have that self-doubt. And in fact, they are self-promotional, oftentimes when women aren't self-promotional. Right. And it comes naturally to them. They always ask for more than we do in negotiation strategies. This is proven. There's data behind it. And so they are also given more because we don't even know what to ask for because we don't think that we deserve it. So how are you helping the residents and students around you to combat this? How do you feel that you're able to do that?
Yeah, I really take it very seriously to be very encouraging, right? So I work with some of the general GI fellows, but I also have advanced endoscopy fellows that I work with every week. And obviously there are different stages of skill, which is totally fine. But I think I'm just as encouraging and excited about everything that everybody's doing at all times. And I'm always like, yeah, this is great. You did such a good job. You're awesome. You're amazing. Like just kind of that positive feedback. But the other thing is too, like as people around me are like looking for jobs and things like that, I'm always like, oh, what did they offer you? Okay, yes, ask for twice that. Or, something like that. Cause it's just like, you're right. Like people, we don't ask for enough. And it doesn't always have to be monetary. Like maybe it's like, oh, they only gave you 4 weeks of vacation time. Ask for 6. Worst case, they say no, or maybe they say, okay, I'll give you 5, right? And either way, you get more than what no one ever puts their best foot forward, right? Initially with negotiations, they always just give you a little bit and see what they can get away with. And I think it's important to just, no matter what it is, whether it's a leadership role, whether it's vacation time, money, whatever it is that you want, ask for it. And that's what I tell people. I'm like, look, again, all you have to lose is a little bit of pride of them being like, no. But it's a small price to pay because they might say yes.
You are correct. And they will often tell you that this is just a standard contract and these are the guidelines and this is what's given to everybody. And there's always wiggle room. And like you said, it doesn't always have to be money. It can be built in, leadership time, non-clinical time. It can be more money for CME, more time off. There's so many other benefits you can ask for. And I think we also do a poor job of teaching women how to negotiate a little bit better. And we end up signing contracts that don't make sense for us, especially in the phase of life where we are growing families and we need time off for that and things like that as well. So I know one of your goals this year has been recruiting more Black people and women talent into the field, and also for yourself climbing that leadership ladder within your own institution and on a national level. So why don't you share a little bit about what you've been doing in both of those areas?
Yeah, so I've gotten heavily involved in the ASG, and I mentioned that's one of the national societies, and also the ACG, which is the American College of Gastroenterology. So both of them have like different subcommittees that you can join. So for ACG, I'm more on the sort of leadership track, if you will, part of one of the Leadership Institute, which is great because I'm meeting a lot of people that I can be like, hey, let's do this. Let's put this initiative out there. And then more recently, I joined the ASG has a women's committee, which has been great. Prior to this, though, I was on the Diversity, Equity, and Inclusion Committee. So that's all kind of the same idea. And we work together quite a lot, putting out a lot of initiatives. So a lot of them have been, thus far anyway, geared towards medical students. But more recently, I've been like, hey guys, why don't we catch some residents too? I mean, those are perfect people to catch before they, go into GI or before they decide they want to go into cards or whatever it is that they want to do.
Sure.
And so far we haven't really done that, but that's something that I've been trying to work on more recently. Within the institution, though, of course, as the associate program director, I'm like, hey, more women, not only for our program, but also even for the general GI fellows. That's sort of been an issue as well. And I sat down with my chief recently. Believe it or not, I'm the only Black person in my whole division, and I have a and I have a large division, so that is problematic to say the least. So I sat down.
How many people do you have in your division?
Goodness, I think it's like 80 of us, somewhere around there.
Oh my, and you're in Boston too. Can you imagine somewhere in Iowa?
I know. I'm like, so, and they had invited me to join this oh gosh, what do they call it? They like hired an outside person, like a consultant, to basically come in and talk to some of the faculty as well as the trainees about, like, hey, how do you feel like things are in terms of diversity at this institution, and do you feel like you have the resources you need, right? And so I attended that and I was like, listen, no, we're missing some critical things. I think my sort of thought process about this always has been you have to be very intentional about recruitment efforts, specifically when you're talking about minority groups. Because what ends up happening is, if you go to a place and there's no other people that look like you might say, I don't really want to be there either. There's a reason why there's no one else that looks like me, right? I don't know what that reason is. Maybe you're bold enough to ask, maybe you're not. But either way, that's what you're thinking. You're like, that's a red flag. There's something about this place, about the institution, the city, whatever it is, that none of the people that look like me are here. So why would I enjoy this experience if they didn't or they won't? You know what I mean? So I think those things are very important. So I think creating and fostering that environment and saying, hey, no, I want you to be here and I will pour into you if you come. I think those things are important. And I think it makes people feel uncomfortable to do that because they're like, oh, it's a little bit discriminatory or whatever the case may be. But I think that's just frankly the way that it has to be in this situation.
Absolutely. So you looking at a department of 80 people that weren't Black, how did you decide, okay, I know this might be a red flag, but I'm going to join here anyway? I mean, I think that's important because how do we start as the women that have to do this?
It's funny. So I think, honestly, I think it's because of my mentor. Like even though, again, he was a white man, otherwise.
Well, we need them too. We do. We need them. I agree with you. I have very fond feelings towards a couple mentors from Columbia that are white men in ortho. And it's because they took a chance on me. They helped me throughout my career path. I can still call them anytime. So right. Sometimes I do want to call this out that it's important as we're bringing other women up to recognize the allies around us. Yes. And lean on them, use them as resources, take them on the journey with us. I think, sometimes the onus is on us to educate and do all this work that feels very tiring, but it is so helpful when we have allies that are also doing that. So I think I don't want to say owe it to them, but like we should also help them understand our mission as they're helping us.
Yeah, no, I totally agree. It's funny though. I think, for me, it was an unexpected thing, not, for any real reason, but I was just like, why would this random person who doesn't know me from Adam decide to be like, hey, I'm going to like pour into you. I mean, really, really stand up and be there and be like, what do you want to do with your life? Okay, we're going to get you there, And I think that made a huge difference for me because I've never had somebody, frankly, outside of my family, particularly in medicine, especially just with all the politics and the hierarchies and things like that, that was like, look, whatever it is that you want to do, we'll figure out how to make it happen. I want you to be happy. I want you to be supported, whatever leadership role you want. Like, so for me specifically, I really care about like hospital operations, passionate outside of the mentoring piece about like hospital waste. And so whether that be time waste or resource waste, as you know, well, we waste quite a few of both actually in the hospital in general. And that ends up costing money, right? Money for one thing, but also it doesn't lead to better outcomes. And so anyway, something I'm really passionate about is like, how do we spend the least amount of money and also provide the best care? Like, how do we kind of bridge those things together? And so anyway, that's something that I'm really passionate about. And that's something I really want to be involved with. And he was like, look, I know you're passionate about this. He sat me down the other day. He was like, I'm going to call this person, this person, this person, and get you on these committees at the hospital. And I was like, oh, wow. Okay. It's like, I mean, unless you don't want me to, I'm like, no, let's do it. You know what I mean? So he's just somebody that is like, just always been in my corner. And I think that's huge. And so to me, that was enough where I was like, yeah, maybe no one looks like me, but I have at least one person here that really wants me to be here, so much so that he's willing to like go out on a limb and make sure I have what I need to be happy and successful. And hopefully down the road in a couple of years, maybe there'll be more people that look like me.
Yeah, we can't go at this alone. I agree with you on that. Now, also the flip side of that is we know for a fact that women are also underpaid when it comes to doing these additional committee work. And hey, can you chair this diversity group? How do you make sure that you're working on your passions, you're making a difference, but you're also being valued. And sometimes that does mean through compensation in some form or another.
Yeah. So, for me specifically, and this is always easier at the front end, I think, but when I was signing or, negotiating my contract, I was like, look, you want me to take on this role, and that's fine. But what you're offering is not going to get you any of these things, nor is it going to get you a happy employee, right?
Sure.
So I think not being afraid to literally say, this is what I need to do these things very specifically, whether it be I need an extra half day off or administrative time or whatever, or like, hey, I need to be compensated monetarily for this. I think it's super important to be able to sort of negotiate that. And, it's uncomfortable for a lot of people, I think, and it was equally uncomfortable for me, but I was like, look, it just has to happen this way. And before I asked for it, I actually called the mentor that I was talking about, and I was like, look, I think I'm going to ask for this. And he was like, yeah, ask for more. I was like, great. I'm glad you're on the same team, And so, I bounced off him, but I was like, this is what I want. And, my chief wasn't terribly excited about it initially, but he eventually came around. But that's just what it has to be. You have to fight for yourself. You have to ask for things, and you just have to let the pieces fall where they may. And also be willing to walk away if you are unhappy with whatever is being offered. And that's a hard thing too, I think.
That is a very hard thing to do, because we often feel like if we don't take this at whatever they're offering, you're going to miss out. You're not going to get, ahead in whatever position you want to get ahead in. And the truth is, there will be somebody that accepts it at the lower offer, and you have to decide for yourself. And I usually tell, my own mentees and other women that it has to either bring me an extreme amount of joy or money, one or the other. It can't just, preferably both. I would like both, but if it can't, then it has to be a true passion project that is bringing me so much joy. And oftentimes I have seen things as, I've never been in this line of work before, and so I'm going to do this at a lesser price point, but the next time, or, maybe I'm going to branch off from there, then it won't be that. So I do believe that you have to do maybe sometimes a little bit of free work to get to the place that you want, especially if you're creating a new space for yourself. But, you have to have that thought process kind of mapped out in your head. But it has been so wonderful chatting with you. I think we could talk about 10 more things from the things that you already brought up, and I probably will call you upon those things in the future.
Okay.
I do want to ask you, what would be your pinnacle pearl to share with other women in medicine?
Yes, I would probably say cultivate your network intentionally. So when you meet people, like literally be very intentional about who you meet and who you connect with. And don't be afraid also to connect with people that you wouldn't really expect to have anything in common with. Like, try to find common ground among all types of different people, because you never know when someone's going to be in your corner. So that is my pinnacle pearl.
I love that. That's great. I always tell people, take the meeting. Always take the meeting.
Yes.
Because if you don't know what you're going to get, what kind of opportunity you're going to get, who you're going to meet, what relationship you're going to cultivate. So I love being intentional about the network and the relationships you cultivate. So I want our listeners to be able to find you. So why don't you tell us where we can find you?
Oh, goodness gracious. I didn't even think about that. Like on social media?
Anywhere. If it's email, a website, social media, please let us know where people can find you.
Okay, so of course I have a LinkedIn, like I think almost everybody else in the world nowadays. And it's just
actually a lot of doctors don't, but that's great that you do have a LinkedIn. Yes, a lot of physicians do not.
That's hilarious. I literally was like, everybody has a LinkedIn these days. Yeah, so I'm on LinkedIn under Iman Boston, nothing fancy about that. I'm also on Instagram and Twitter. So on Twitter, I think it's at Iman Boston MD. On Instagram, it's at Dr. like Dr_BOSSTON, play on words there.
Well, thank you so much. I so appreciate you and for chatting with us on the Pinnacle Prescription Podcast. And I can't wait for you to come to a Pinnacle conference.
Absolutely. Thank you for having me. This is great.
Yeah. Take care.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.